Welcome back.
Yes, this is a big week. We're going to talk about this one tiny little word that makes all the difference, I believe. Hope.
Yeah. So why are we talking about this today?
Honestly, when I had some hope, I realized that I could move forward. And when I was first considering that I had cancer and like going through all those tests, and I felt like every time that a test didn't go well, just a little bit of hope, went away, went away. And then it was fully taken away by the doctor, who was like,
Sure.
You're done. Get your affairs in order. You're done. And the longer I lived, the more I realized that without hope, we don't have anything.
Yeah. And we would all like to think maybe that, we supply our own hope.
Yeah.
I'm in charge of hope. I'm in charge of I can do something or I can't do something. But it's just not true. Other people impact us all the time.
Yeah.
In all areas.
Yes. It is, I think, our responsibility to consider what other people say, but it kind of goes back to talking about the fact that you can't unhear, you can't unsee. We're people who are constantly judging, looking at how other people are reacting. So, you can tell when somebody is saying something to you and they don't believe it, right?
Mm-hmm.
You can, it's just so impactful when somebody is willing to go with you on this journey.
Put it out there. Yeah.
Yeah.
And when you are a stage 4 metastatic cancer patient, that hope world or the I don't know, the guts, I don't know what that is, to say, no, I'm going to give everything I have on my side of this.
Yeah.
I need you to do it too, and for them to come along and go, okay, we are going to do this. Statistics don't support that. And the statistics are getting better, but statistically, it doesn't support that, yet it's all the difference in the world.
It is all the difference in the world. The other thing that I think that's so important about that is, like, you hear that healthcare providers that want patients who are going to participate in their care and who are going to, do what they need to do, make the changes. But you also have healthcare providers who squash hope on a regular basis.
Unintentionally, and I hope every case.
I hope so too, but I don't know if people realize it's a unique situation when you're a patient. You are the hyper hearer. You are watching everything that this person is doing and saying. And it's not just the oncologists. It's not the doctors. It is the techs. It is the people that are drawing your blood. It is everybody. You are
and it's your circle.
Trying to garner. Does this person believe in me?
Yeah.
Do they think I'm going to die? Is there anything that's...
It's everybody in your life, though.
Yes.
Those are the people that you're going to get rid of cancer.
It is everybody in your life. The thing is, though, with healthcare, we've been taught to put these people, their opinion on a higher level, right? They know more than us, which is... Also, I think one of those things that you just have to come back and realize, like, they do know more about medical situations, but they don't know your situation. They can't predict that, so.
Yeah, early on, you kind of adopted a few mantras.
Yeah.
But one of them was, why not me?
Yeah.
Or...
Try me,
but it kind of got, why not me?
Yeah.
And
that's, I just kind of.
But that's what that's talking about is, if whatever percentages, if there, it's not zero
Right.
on the other end.
And nothing is zero. Like, well, a few things.
There are some things that are
Okay,
zero. Yep.
okay.
Some of them involve weapons and stuff like
Okay.
that. But most of the time, you're right. It's not zero. Then why not you? Why not do everything in your power to
Yeah.
do that? Well, it's hard to do everything in your power if that hope isn't there.
Yeah.
Your
Yes.
power diminishes
Absolutely.
without, and I keep wanting to say someone giving you hope, but it's often the truth.
Yeah.
It is given.
Yeah.
You know, it's a given thing and a taken thing. And I believe in you. You know, you took that and then gave yourself hope. So it was offered. Maybe that's the best way to put that. It was offered by the words of a doctor, hope. And some people might choose to ignore that. So
Yeah.
therefore hope wasn't
Yeah.
given.
Yeah.
Whereas you have to then take that and give yourself hope. And that's I believe that would be challenging for me. I've never had to do that. But I'm sitting here with you who did do that. So
Yeah, I think some people are more likely than others to see maybe the glass half empty versus
that's kind of what I'm saying. Yes.
versus half full, right? Or a drop.
Is
in the
that
glass.
changeable? Is someone's, there
Yeah.
are people who are that.
I believe it is. I believe because of all of the work that I did mentally that it is something that can be impacted. So I don't
Improved?
improved, but you have to take the time to do it, and you have to be conscious of what you're thinking about, and you have to do these things that we've never been taught to do. Or
And I
never
think
been
that
taught
somebody
about.
listening might just be like, no, I want to have hope. And
Yeah.
and they did say this positive thing. So I want to have, I don't think it's something you can just wish or go, I have hope now.
No.
I don't think it's that.
No.
We're leaving off, months and months of you working on things to give yourself hope.
Yeah, no, the hope comes through the conscious decision to think about that was good. The conscious, what brings me hope or what helps fill me up. I'm going to think about that. I'm going to write that. I'm going to...
So, okay, let's go back though. Where did your hope start? We know when it was taken away from you, when you were
Right.
told get your affairs in order, you're not going to make it.
Yeah.
Get out of here.
Yeah, no, I think it started probably with the conversation with Dr. Mariver when she said, get some green tea, eat some fruits and vegetables, and we'll start killing cancer on Monday. So one thing I often talk about is working from your strengths. And I think, for me, I don't know that I knew that I was mentally tough or mentally capable of all those things at that point.
You were too young to know.
But I was like, well, I can follow directions.
And I think that's the thing is she gave you an action.
Yes.
You performed that action which put you
Yep.
in motion.
And I will say for that too, the difference is I've talked to many people over the years and they'll be like, oh, did you have to change your diet? And the answer to that is no, didn't have to. Mm-hmm. Chose to. And not only chose to believe it was helping.
Yeah.
Right?
So it's not a negative.
To
You
believe
made
that it was impacting me.
a positive.
Rather than the other way, looking at it as now I can't, now I this.
What are other things you did in that manner?
Well, again, started like really listening. I started learning about visualization. Like the only thing that I could find that was somewhat hopeful at the time that was sort of related to cancer was this tape. It was literally a cassette tape, people, that talked about, kind of the light entering your body. It was done by Bernie Siegel, who was a doctor who was, talking about the fact that our minds could play a role in some of this. So listening to that every day, that was kind of like, well, I can do that. Mm-hmm. And then letting myself hear that. And then I think that led me to realizing, wait a second, I need to pay attention to what my thoughts are, like what is really happening. Because what I would do this visualization and I'd feel okay until the thought that I was like, oh no, my something hurts in my back, that's cancer. I would be fine until that came. And then I had to figure out how to deal with that, right? Mm-hmm. And that happened within an hour, or that happened sure. It was always coming, right? Or something on TV that talks about cancer, or something, somebody talking about
somebody dying of cancer.
Somebody dying of cancer. Yeah. Or on the flip side of that, somebody saying, oh, we're going to go skiing next month or in next year. And I'm like, yeah. Oh, I don't even know if I'll be alive. You know, like all of those things where I'm like, stop. I have to stop. I have to figure out what to think about instead, or how to change it to a positive. And so I worked off the things that I felt like I knew. So for me, bone mets, I had innumerable bone mets. And a few things with that, like I was very specific with my doctors and healthcare providers, like, stop telling me where they are. I know it will just make me worry about them more, hurt more, all of these things. But I did know where some of them were. So like pain in my back or sternum or whatever, I would be like, that's a cancer. And then I was like, wait a second, I started treatment. So that's the treatment working. That was my thing.
And if you know, a lot of people refer to chemotherapy as a poison.
Yeah.
And you didn't.
No.
I mean,
not at all.
Not a poison going in your body. That's bad.
Right. No, it's the medicine. I mean, it's funny because I was thinking about this just recently, because we've always kind of called it my medicine. I think some of that was because Sydney was quite little, and so we were just simplifying things but also I was never going to call it poison. Mm-hmm. I mean, that was not going to happen. So it's all of those things where I took the medicine to be good and truthful, and then I would take a thought that was bad and apply that to, nope, that's the medicine working. Yeah. Like, again, I don't know a ton about cells, but I'm like, okay, maybe it hurts to destroy cancer as well. Like,
yeah, I remember you telling me about this even during the days after a chemotherapy session or whatever, mm-hmm. and you describing to me what you are seeing happening on the inside.
Yes.
And I was like, wow.
Yeah.
That's cool.
Yeah. And again, visualization taught me that I could think about what it looked like, and that I could think about it in a way that was going to impact me positively. Right. And even, taking that a little farther down the road when I get to the next bone scan. And again, with bone scans, you can often see your skeleton and these little, stars show up. And I was like, okay, wait a second. It can't determine, like, maybe it's healing, it's activity, like all of those things. I would always like, how can I find the positive for this? Right. Mm-hmm. The other thing is, when I couldn't find the positive, I would go back to things like, that's where working out was helpful to me, because if my back hurt, I could say, yeah, I lifted today. And you were very good about helping me with, like, everybody has aches and pains, or that's, again, your muscles getting stronger, or whatever that was. And I don't even know if it was all truthful, but it was my truth, and it helped
I would say,
me.
Hey, didn't you lift yesterday?
Yeah.
And then you did the rest with it.
Yeah.
And this is what I want people to hear is, this did not happen overnight. It wasn't a decision you made that, I'm just going to change everything in my life to a positive.
I was scared out of my mind for so long.
Years.
Yeah.
Years after treatment.
Yeah.
It was still scary. But the difference between you and me and a lot of other people is, you just have that ability to sense that I'm going down a path that's not mentally good for me, and reverse it. You've practiced it so many times where I could do it, intentionally. No, I'm going to, and whether that's through meditation or however I'm going for a run, however I do that, I think I have the ability to do that. But it would just be, I think you almost got to a subconscious level of, This is what I do. It's coming in. Nope.
It's not coming
and I'm going to...
And honestly, I also verbalized a ton of that, right? And I would do it with people. So I think still some people think I'm a little too much, and that's fine. I'm pretty like, nope, you're not going to say that. Or, even we had an encounter just this last, week or whatever. We went to a nurse practitioner that we weren't familiar with or whatever, and she started to like read my scan, and we were both looking at each other like, how the heck do you not know that we do not read scans? We do not do that. And we were
both ready to jump on her, and then she stopped. And,
and it's one of those things.
And not jump on her. I don't want to say that in a negative
way.
No, but just say, hey,
this is not how we do things. Yeah. And again, like, it feels good to be able to advocate for yourself. And it's okay to tell people that they're making you uncomfortable. It's okay to tell people that you don't want to hear that. Or, like, for me, I could even say specifically, like, we don't do it this way. We do it this way instead, to just go, like, just because you've always been doing it like this doesn't mean that it's okay or that it feels good to me. And so advocating for myself, some people are just not going to get it. Don't be around those people. Like, just don't be around those people. And if they're people close to you, you still can make boundaries. You can still have boundaries with them, So you can't have the people who are sucking the life out of you when you are trying to hold on to hope.
No doubt.
No
doubt.
Just, I don't know. I just think as somebody, I think it's so natural for us to put our stress on other people. That's how we kind of deal with it a lot of times. And I think it was just, I couldn't do that. I couldn't do it for years. Like, right. And I'm still protective of myself. I will always be protective of myself and my stress level and those kind of situations, So.
And I think now you've gotten to the point, maybe for a while now, but now you want to advocate for other people in that
Absolutely
realm. You want to educate is what you want.
Absolutely. And I guess we should maybe talk about that too. This is the other thing early on. People would, tell me to get involved in a support group. Well, number one, I was 26, and any breast cancer support group was going to be a bunch of 50 to 60-year-olds sitting around talking about things. The other thing, though, that it was I realized that I couldn't take on their issues. I didn't want to go and commiserate with somebody. And I knew that it would scare the heck out of me. I mean, the realistic part of a support group is there are people that are closer to dying than you are. And I could not do that. And now, because I'm 25 years out, I can walk with somebody who is not having the same results as I am. And I can talk about death also because of, I think, all of the time I've spent with the elderly population. I don't view it as, it's not being defeated, right? Death. But I just recognize that some of these things don't work because there's no protection of your brain, your thoughts in that kind of situation, right?
Yep.
And if that adage of surround yourself with the people or you're the sum of your five closest friends is true, then for support groups, we got to do it different.
Yeah.
Like, I do understand that some people really feel a need to know more about things before they do it than I do. And but I think there's better ways to, like maybe mentor type of things over support groups. And
yeah. Yep, I agree with that. What about for those should-be hope givers?
Yeah.
All of them, there's thousands, in a medical, environment. Those hope givers, I don't think they know they're hope givers. A lot of them. I would say the enormous majority of anyone who works in a medical setting, you're a hope giver.
Hopefully.
You should be. And I bet 2% of them know it. 1% maybe.
I think it comes down to I don't think we talk enough about the impact of our actions and words on other people. And so because of my extensive experience as a patient, I feel like I always approach patients, people in healthcare, when I'm working as an occupational therapist, in a different mindset where
I guarantee you do.
I know. But it's so for me, I'm always considering the fact that when I'm there, my job first is to connect and relate and provide some hope to somebody way before it is, hey, let's
But I think,
therapy.
And I think there's a lot of fault in this one. But when hospitals started getting bigger and bigger, when they started getting bought out, there was a big push for customer service.
Yeah.
Customer service. Because as a patient, you are a customer in a hospital. Yeah. But customer service. And I think there was big improvements. Being nice does not equal hope.
No,
being mean does not take hope away.
Right.
We're not talking about that. We're talking about hope. And it's the words that are coming out, not how they're coming out of your mouth, is a non-factor. It's the words.
I think it's the words. I think it's also just like, it starts with feeling seen, right? And feeling seen for the circumstance and seen as a person.
But not feeling sorry, though. I don't think that's where you're going.
No, I don't want to be felt sorry. Yeah. I don't want people to feel sorry for me. And I hated hearing, oh, you're too young for this, or I'm so sorry. I hated that.
Do not call my wife sweetie.
And do not, again, those are the kind of things.
Triggering words.
Very triggering to me. But I think it's just, there are ways to let a patient know that you see them and that you're rooting for them.
Yeah.
And also that you are considering the circumstance they're in. So I have always said like that nuke med techs are kind of my nemesis, right? And for a variety of reasons. But one of them is like talking when they first come out, you filled out all of this paperwork, like 2 pages that no one read. And their first question is, have you ever had a bone scan? And I'm just like, have you ever done a bone scan? Like, come on. Of course I've had a bone scan. And I understand also that the information that they're really looking for is, do you have any questions? And so say that. I see you've had bone scans in the past. Do you have any questions today? Makes me feel so much more seen, right?
Yeah.
So much more seen. Also, I think it's important to realize that even the healthcare system in and of itself can be very triggering, right? I have advocated to not have to sign whether or not I'm pregnant, to not have to sign off that I'm not pregnant. I had that taken away from me, and it is triggering to me. Don't ask me. I can't get pregnant. So, and people will just like, well, we ask that of every person. And I'm like, it doesn't trigger every person the way it does people in my circumstance, or people who are infertile. There's a lot of us. And also I just look at that and go, okay, we have technology. I gotta believe there's a way for you to flag my chart. I will sign away liability for the rest of my life. Mm-hmm. But flag my chart and quit asking me, for the love of God.
I apologize for getting Heather fired up here on this. We were supposed to be talking about hope.
But no, these
are the big ones.
These are the things that...
where hope is taken away.
It is. It feels so defeating to me. So I'm not willing, because I do have the energy and I am healthy enough. I am not willing to let those things go anymore.
Yeah, right.
I do every time I get, you know, labs drawn or things like that. I'm the first one who's like, small needle, please. My veins are crap.
Mm-hmm.
You know, I am the one who I advocate for myself all the time, but, it also, the people who are happy to let me do that are the people who I'm like, you get me, you know?
So do you have specific examples? I mean, other than the huge one, which is Dr. Mariver and that talk, and but I think she gave you hope 150 times after that. I know other people in situations. What examples did you come away? What things did you remember? And I know this is putting you on the spot for this, but do you have things that you remember down the road from, wow, that was, which whatever treatment you were doing, or?
Yeah, I mean, I remember certain people, and I couldn't tell you necessarily specifics, but it was how they made me feel, not what they did.
Okay.
You know what I mean? I'll never forget Marlene.
Mm-hmm.
She just, again, her presence was, we're going to get through this together. How can I help you? It wasn't condescending. It didn't feel hurried. All of those things matter. There's a person in Nuke Med at U of M that I'm pretty sure that they did finally flag my chart to go, oh, she gets her. Mm-hmm. And I appreciate that, because again, she did understand why I was frustrated about the things that were happening. She made a conscious effort to change what she could. She learned to, like, even one of the things that I would get upset about would be like a needle stick, and then, you know, later in the day, them having to draw something else. And it's like, why did you not? And, you know, just learning to, how can we better communicate with these type of situations? So, yes, many people who I felt like they're doing a great job and they're relating to me. During my stem cell transplant, the PA that would come in every day and play on the Magnadoodle, which again was just kind of like, which was there for Sydney to play with, but also it just was kind of like, I'm a person too. I'm not, and I'm seeing you for who you are. Yeah. And, you know, I mean, I don't know. I've had a million surgeries. And there's been a lot of really good people too, but when you're in healthcare, I think it's an opportunity to put whatever's happening in your real life away and just focus on the people who are coming at you and see if you can make their day a little better. I get it. Your time is crunched and I understand all of those things, but it doesn't take a lot to ask the right questions, or,
you know, and if you're likely the people listening to this are not healthcare workers, they're patients, they're metastatic.
And caregivers.
And caregivers, you, like she talked about before, you can, it's a big word. You can demand that they treat you like a person.
Yeah.
You can advocate for that. And whether that's in writing and on day one, anywhere you go, read this. Mm-hmm. They're going to read that. This just paragraph that just gives you your mantra, and they're going to go, oh. And you want to talk about a difference in how you are looked at or how they treat you, there will be a difference. And there's other ways to advocate for yourself. It doesn't have to be that. But if it's a smaller setting, more people are going to know you. If it's a bigger setting, that's harder to do because you're getting new techs and new nurses that are working with you all the time. But you can advocate for people treating you with respect and like a person. And in turn, that's going to give you hope.
It does. It does. And sometimes by doing that, it kind of helps somebody just go, oh, they realize it. And then you can have this real relationship with them. You know, it's almost like you're giving them permission to do it differently. And that's good for everybody. Yeah. Well, that was hope / advocacy. Which I think what that comes down to for me is that you get to decide how you do this. And it is a challenge, and there's going to be days that you are struggling, but you get to decide what to reach for and how to build that kind of toolbox of things that do provide hope. And ultimately, there is no false hope. Like, there's no, you know.
No, there's, you know.
I will never be on board with people who are like, well, I just felt that I had to tell them how
The
it
truth.
really was.
The
how
truth.
it's really going to be. And that's just,
Yeah.
no, you don't, because you don't know.
No.
You don't know. So.
Well, I'm glad people in your life and in your treatment gave you hope.
Yeah.
Throughout the way, because I think it was a game changer and allowed you to do the things that you were able to do.
Yeah.
In the end. So.
Yeah. It's just like opening a door, right? It's
Yeah.
opening a door. It's just that little crack of light.
Yep. All right. So I hope people are giving you hope. If not, demand it. Advocate for it. You can do it.